This is the test collection instructional video for the Genova NutrEval test kit. You will have either gotten this test kit in our office or you have had this shipped to you. All payment is due to Genova. So before you either gotten this in the office or had this shipped to you, we've already activated it under your name and filled out some basic information. After that, you will have gotten an email asking you to fill out the rest of the information to finally get this submitted. That includes some patient information, credit card information, and insurance information. If you do want to bill this through insurance, that is a possibility. There is an initial pay before you do that, and then they'll let you know if there's any leftover balance after they bill it to your insurance. This test kit is a few different kinds of collection samples. So here we've got a cheek swab, a urine collection, and there's also a blood draw. All of these collections have to be done on the same day. It does require a little bit of planning. The blood draw is going to be done in our office, so please make an appointment with us so that we know you're going to be coming and that we can do that blood draw for you and get that test kit shipped out. I'm just going to note a couple things that are important on the test kit instructions and things that we have learned about this test kit. 4 days before, you're going to want to avoid acetaminophen, which is Tylenol, and berberine HCl. That can interfere with the test. 24 hours before, you're just going to want to eat your normal diet that you normally eat. Don't overeat any single item, and don't do this if you're on an extreme diet or detox diet, as that can influence the results. You can drink water, obviously, before the test kit, 24 hours before, but try not to drink more than 6 8-ounce glasses of fluid so that you don't have a super dilute sample once you get around to the urine collection part of this test kit. It is also a fasting test kit, so please don't eat or drink anything but water 10 to 12 hours before you collect your samples, your first samples. And then you're going to want to make sure to put this brick that's included in here, this frozen brick, into the freezer at least 24 hours before, if not longer, to make sure it's nice and frozen by the time we're getting around to collection. The morning that you wake up and want to do this test kit, don't brush your teeth, floss, or use mouthwash. Don't use tobacco or nicotine products, chew gum, or take any coffee products. You may drink some water if you're having some dry mouth issues. Also, the night before, you may brush your teeth and floss, but do not use mouthwash, even the night before testing. So the morning when you wake up, you're going to do this cheek swab collection immediately. There's 2 swabs in here. You'll open this up, kind of aggressively scrape the inside of your cheeks, both cheeks with both swabs, and let this sit somewhere clean, open for 15 or 20 minutes until it dries. Then you can put it into the sleeve and then into the envelope. Make sure to also put one of these labels on the envelope as well. For the urine collection, it doesn't look like they actually give you a cup to collect in, so you're going to want something clean and dry to collect your sample in. And then they have a pipette here where you can transfer that urine into 3 different tubes. You do have to fill all 3 of these tubes. Make sure to affix labels to all of it. If you wake up in the middle of the night and have to urinate, and it is within 6 hours of when you normally wake up, so for instance, you get up at 8 a.m., you wake up at 3 p.m., that's 5 hours before you normally wake up, go ahead and collect that sample and then keep it in the fridge. Once you actually wake up for the day, collect another sample, mix it with that overnight sample, and then put it in the test tubes. If it is more than 6 hours after you normally wake up, say you get up at 8 and you wake up at midnight to go to the bathroom, don't bother collecting that sample. We just want stuff within 6 hours of when you would normally wake up. These urine tubes are also going to be frozen for a minimum of 2 hours. So how this is going to work is you're going to wake up, do the collection with the cheek, do the collection with the urine, put this in the freezer, make sure it's with your frozen brick, and then you're going to come in for your blood draw a minimum of 2 hours after you've done this urine collection. So if that looks more like 3, 4, 5 hours for you, that's fine. We want to make sure these are frozen, and we want to make sure it's at least 2 hours after you collect this before we do our blood draw. So you'll come into the office with all of your collection materials. Obviously, you need to bring your samples with you already collected, all the prepaid packaging, the rest of the test kit with these samples for the blood draw that we're going to do. These are all of the tubes that we need for your blood draw. So bring all that with you and definitely include your frozen brick. We will process the blood tubes once we have done your draw, and then we will ship that package out for you. So there is a prepaid packaging here. We will make sure that's filled out and get that submitted with FedEx the same day. Since we're only open Monday through Friday, we don't have to worry about a weekend collection sitting anywhere in a warehouse over the weekend. So you will come in between Monday and Friday and we'll get that shipped out, so there shouldn't be any issues there. If you have any questions about this test kit, please reach out to our office and we'll clarify as much as we can. And again, please make an appointment to come in for the blood draw.